we have to first take a consent of the patient, and after taking the consent of the patient, we have to explain the procedure to the patient. 7,000-8,000 with a normal hemoglobin and WBC count. So my clinical diagnosis pre-bone marrow biopsy is ITP. So let's see what it comes in the ultimate diagnosis. This patient has no history of bleeding, but he has a history of headache, and he evaluated and found to have low platelet. So we are going to do the bone marrow biopsy to find out the cause of low platelet. So after consent and this painting and draping, I applied betadine. Now I am applying the sterilium or spirit. You can apply in a circular motion from inside to outside. Don't come from outside to inside, because outside area is an unsterile area. So I did the painting. Now I will guide you how to go stepwise to do the bone marrow. So now we are sterilizing the local areas from where we are going to perform a bone marrow biopsy. So now we have done with this part. Now we will giving the local anesthesia with the xylocaine 2%. The procedure is usually done in a local anesthesia. So we will going to give the local anesthesia now with 2% xylocaine. So I am preparing 2% xylocaine. It's readily available. So we are usually giving in adult patient around 10 cc of local anesthesia with syringe and needle. Will administer to the local site, posterior superior iliac spine. So if you can see here, this is ideally the posterior superior iliac spine. So the general marker of posterior superior iliac spine is the most deepest part on just above the buttocks. Is usually a posterior superior iliac spine, but you can feel posterior iliac spine is the most prominent part. So now after painting and draping, this is posterior superior iliac spine. So I will going to guide to the patient in a local language. भैया एक सुन करने का इंजेक्शन दे रहा हूँ. हाँ, दर्द नहीं होगा तो ढीला छोड़ देना. कुछ प्रॉब्लम है तो बताना. हाँ, कुछ होगा नहीं. So now I am going to give the local anesthesia to the posterior superior iliac spine. So first I have to infiltrate the skin. Relax. So infiltrating skin is very important, because all pain sensation goes from skin to the nervous system. So giving good local anesthesia and infiltrating the skin with the 2% xylocaine is very important. After infiltrating the skin, you can go deep down to the posterior superior iliac spine. Right, so I am almost reached to the posterior superior iliac spine. So you can see my hand movement. Right, I am giving to the different layer in and out. I am making my needle with syringe which contains 10 cc of 2% xylocaine local anesthesia. Bone and periosteum is the most sensitive part for the pain, so you have to give good local anesthesia to make the whole procedure pain free. So many a times we can give even more local anesthesia. Even you can give 15 to 20 ml in some sensitive patients as well, but most of the time 10 ml is more than enough in most of the patient. When the patient is very obese, maybe sometimes patient is 100 kg or more than 100 kg, the fat is too much. Instead of the normal needle, you can use the spinal needle to infiltrate the skin and periosteum and bone part. So now we are almost done with the giving the local anesthesia. Now I am going to make a small incision to facilitate my needle of bone marrow biopsy to the bone. So now I am going to give a small incision which helps me to facilitate to introduce my bone marrow needle into the bone and periosteum and part of the bone marrow. So this is a bone marrow needle, bone marrow biopsy needle. So before entering into the bone, we have to check this needle, so whether it is patent or not, everything is okay or not. So I am checking this bone marrow needle. It looks okay to me. So this is Jamshedi needle for adult size. So now our procedure for real biopsy will start now. So I made some small incision on the skin, and now I am entering to the bone in a 90-degree fashion. So first I have to locate the posterior superior iliac spine, and I have to ask the patient for pain. If he is saying that he has still pain, I can give more, even 5 cc local anesthesia. दर्द हो रहा है भैया? नहीं ना, चलो अभी होगा नहीं, हो 2-5 मिनट का काम है, सब बरोबर चल रहा है. So now I am in the almost the posterior superior iliac spine. So you can observe my wrist movement and bone marrow needle. I am going into the bone gradually, and once you get into the bone, you get the firm feel that okay, it is in the bone marrow. You have to take extra care just to avoid the bleeding, because this patient, as I told you, is a 7,000 platelet count. So now I am almost in the things. Once it is in the bone, you can get the hard feel, right? If it is loose in the soft tissue, it will be out. So it's okay, it's in the bone, so it's a firm hard feel. Now we have to remove that inside part of the bone marrow needle from where we going to sub the material, that is aspirate. Long legs. Now I am going to suck the bone marrow. You can see the bone marrow here. This is a bone marrow. So first we will make couple of slides for the bone marrow. So I am going to give that to the technician, and I will collect even more bone marrow, around 3 ml. We will collect that bone marrow in a EDT and heparin. Relax. हो गया भैया, हो गया. So sometimes this is a real sign. When you suck the bone marrow, they feel the sucking sensation of the pain. So that means you are in the cavity, in the marrow cavity. So he is feeling the same thing. So we are in the bone marrow. Now I am removing the needle. So this is called as a bone marrow aspirate. So once the aspirate is done, so after the aspirate, you have seen the aspirate. Now I am going to take a trifine part. It's little difficult, but you must take a trifine sample to the most of the patient, because aspirate will give you idea about the morphology of the blood cells, like red cell, white cell, platelet and marrow cells. But when you want to know the cellularity, when you want to know the infiltration in the bone marrow, like leukemic or lymphomatous involvement or some metastatic lesion, you have some stain and ISC on the this bone marrow trifine. So the initial procedure would be the same as aspirate, but whatever it will change, I will give the commentary. So the same aspirate style, I am entering into the bone, right? The way I entered for the aspirate. Now it's in the bone. So now the difference between aspirate and trifine is that so I'm removing that inside stellate from the needle. Now the difference, now if we want to do the aspirate, we'll directly attach the syringe here and withdraw the marrow material, that is aspirate. But now I want to take a trifine. So now see, whatever the length of the trifine I need, I make some mark. You see my finger. So from finger I will enter into the bone. I am going in a circular fashion. Relax, हो गया भैया. Into the bone, and once my reach index finger to the site, I will move it around 10 times. And anti-clockwise I am separating this to the surrounding bone. So I am taking out the needle, so it's almost done by my feel. So we will see how much bone marrow refined piece I got it. By my feel it's good refined sample. Let's see. Now the sample which I collected, I am going to remove it from the needle to the slide, and we'll make some small things. Right. So you can see here, this is the excellent refined piece. Right. You can see this is the refined piece. Right. So this piece is very much excellent, and we will make some touch preparation from this refined piece. That also gives us a lot of good idea about the cellularity and morphology as well. So this is how we make a touch preparation. You can see this is touch preparation. So we are taking some print of the refined to the slide. Right. So it's an excellent piece of refined comes. So this is, if you can see, there are 5-6 prints which also contains good cellularity, and this is a piece of refined. So it's a very nice piece of refined, you can see on the slide. So it's a excellent refined came. So we will send it for both the things, aspirate and refine. As I told you, this patient has a 5000 platelet, so I will press hard little bit for 2-5 minutes just to ensure that I'll get a good hemostasis, and check before closing the things that okay, there is no bleeding. So this is what the procedure is, and we will update you with the result, that what it will comes in our next video. Thank you very much. So this is all about